All right, well, we'll go ahead and get started. Are we good on the Twitch stream? Oh, I'm going to take the fact that he's leaving as a yes. Cool. All right, so I am excited to have Michael come and speak for us today. I'm fortunate enough to have known Michael and gotten to work with him at work, and in offensive capability from a security perspective. He's presenting today on medical device security, which I think is a really important topic. Sometimes security and information security can seem really abstract, but when you have devices that are literally responsible for keeping people alive, security should be a very important consideration. So Michael's done some really cool research he's going to share with us today. So everybody, as a reminder, feel free to engage with your emojis. It's as a speaker, it's nice just to see some interaction. So don't be afraid to push those buttons. It's not distracting. It's good to see. But with that, please welcome Michael.
Everybody. Again, thank you for coming to the talk today. Again, as Trent mentioned, today's talk is going to be about medical devices and computer security. The agenda is just going to cover a small bit about who I am, just my background. Then we're going to go into some of the tools and the tooling I've used to assess these devices in various forums. From there, we will go ahead and go into some of the things that I've seen with regards to items of notice with regards to assessing these devices and the overall scope, and then just how I see the overall landscape changing with regards to the production and then consumption in a mass market. So a little bit about myself. My computer security, I guess, experience started with doing malware removal and analysis and incident response and antivirus deployment in an enterprise kind of setting for an antivirus vendor. It was kind of a beginning of my career, but necessarily it was very interesting to me. I worked there during WannaCry, which was in itself very interesting during that time for an antivirus vendor. So that was an interesting thing. Had to do with medical, go figure. From there, I went to a Department of Defense consulting firm. It was something that I view as kind of a necessary evil. I learned a lot about necessarily how to be a consultant, did a lot of interesting things, but it led me to my third employment area, which was medical device testing, security for an internal job for a vendor. It was pretty eye-opening with regards to doing things and kind of assessing devices coming from kind of a network background. But I enjoyed it, and it led me to my current job, which is at SecureWorks, which I actually enjoy very much. It's kind of the culmination of everything that I like, and it lets me expand my skill set and kind of do the things that I like to do, and kind of just like kind of do my thing and wake up and kind of enjoy my life. So enjoy that kind of heartily, and for that. When I have free time, I tell myself that I'm actually going to do something outside, but I always end up behind a computer terminal, which I kind of need to work on in that regard. But just overall, just get outside. You need to kind of enjoy life and kind of do other things other than just sitting behind the computer, because it will be there at the end of the day. So why I'm speaking, a little bit about myself, again, on the background, other than, the work. Kind of a lifelong, thinking at this power cord, lifelong fan of medical devices. They've kind of been ingrained in my background. Grandmother worked at a hospital. She was the head nurse there. So she was always bringing us into her workstation. And again, obviously being a nurse, there's a ton of devices that are used to save people's lives around that kind of office. My mother, she worked in the medical field. She was a transcriptionist for a number of years. So that was why I had a computer in my life from an early age. But we're always going back and forth at the doctor's office, dropping off tapes and stuff so they can do the transcriptions. Lead to my stepfather when I was about 13. He was a paramedic for LAFD for a number of years, but necessarily, again, in that forum, there's always a bunch of medical devices within the back of a paramedic's ambulance. So I was kind of touching and seeing what those would do. And I volunteered at the hospital. So, but then we go to DEFCON 27 a number of years later. If anybody remembers that, I was grabbing the moon. That was pretty interesting. I was front and center for that one at DEFCON 27. But at DEFCON 27, while I was there, I went to the biohacking village. And if anybody hasn't been there, I definitely recommend it. I'm a fan of the village itself and necessarily the work that they promote to do, which is the betterment and the or thinking of device security with regards to, I guess, bringing things online. They have a number of devices, and device manufacturers come to the forum. They bring their devices, and us as testers get to test these devices in an open forum, and again, get to work with the vendors in theory to have these findings released, and kind of work with them to kind of make things better. During my trip to DEF CON 27, at that time, I was able to get a kiosk escape on a device. It was a very interesting set of keys that were pressed. But needless to say, the result was, after many months of meeting with both the FDA and CISA, the flaw was released. But the interesting thing to me was that once that flaw was released, there were two other people that were involved in the release of that flaw. I had never met these people. So again, it was interesting to me that they were associated and mentioned by the business as having located this flaw. And after many meetings, we were able to verify that basically they had brought this flaw to the vendor in various aspects, but necessarily after the third release, or the third iteration, which was myself going to DEF CON 27, and this item was finally released. So after that time, I was kind of, needless to say, a bit fed up with medical devices. It was months of meetings to try to get this flaw at least released in a public facing forum. But then again, my interest changed from kind of anger to, I guess, curiosity. I started getting curious as to why kind of the topography of medical devices as I saw it was so down level. It's why everything was kind of seemingly so flawed. Again, as a slide show, there's a lot of interesting things that are going on with the devices, bringing these things online. But again, you're bringing these devices online, but not properly assessing how they function currently in a even closed ring topography versus bringing these things online. So my curiosity was why these things are being made in such a way, and kind of how these float through all the way to production and mass consumption without certain checks that you would see with certain network devices. So I started reading, downloading anything I could with regards to medical device technology that was an application online, checking things out, downloading packages, running strings on things. I was accepted to a few closed medical bug bounties, so that was also an interesting forum of getting access to device technology and such. But anyways, I started messing around with things. So then, fast forward, I've assessed a few devices during my careers at various places, but these are some of the things that I use heavily when I do test things. One of them being Wireshark. Again, you want to see kind of what's being sent from the devices back and forth, because you kind of want to know holistically how they operate in a networked environment. As these things are being brought online, you kind of want to know what data is being sent back and forth. And an interesting thing with medical devices is the HL7 protocol. This, again, is a system-to-system communication protocol used in hospitals, so certain devices can speak to each other in a similar language. But the interesting thing, at least in my regards, with testing things in a cybersecurity nature, is that it's plain text. Which, again, with your sending information back and forth with regards to how a patient's being treated, what they're being treated for, and necessarily, how they're being treated, you don't, at least in my eyes, want to have that in a plain text, but it's an interesting thing that this is still plaguing the medical infrastructure. Also, with regards to HL7 is a flaw regarding ARP spoofing, which necessarily can cause multiple issues. And you could intercept the data in transit and then send it on forward, and do any number of attacks with regards to intercepting data. So again, watch out for traffic if you're ever assessing a medical device, and kind of see what's going back and forth, how they operate, what they send to, and how they send it, because you can get a lot of interesting information that way. Also, when I assess medical devices, I always try to make sure that I have some kind of RFID scanner with me. Again, I've noticed that with regards to how things are used in a medical setting these days, having the proximity scanner is key because a lot of these peripherals utilize these RFID tags for assets that they ingest. Sometimes assets themselves are marked with an RFID tag. What this poses is an interesting attack vector in that necessarily reading the tags is great. And normally, like when you're doing a standard assessment with a Proxmark, you would want to clone something, which again is good in this case. But writing to the tags is ultimately something that you may want to achieve. Again, utilizing this RFID scanner, you can scan and intercept the data, but if I can write to a tag and say that a function had been performed when it really hadn't, in a medical setting, this is something that you necessarily would not want to happen. You want to have that paper trail to ensure that something that has been done has verifiably been done. So in the sanitization or in any kind of consumption, you would want to make sure that X has been verified as sanitary, or that if somebody got something that was like a scalpel that had been cleaned, or that an object was new. So again, if you could write to this and make it clean or a dirty object clean and then repackage it, this could be potentially bad in a medical setting. Another thing that I found useful is sending traffic to devices. HPing3, it's 2021, and yes, this still works ridiculously well against some of these devices. Depending on the network stack that's being utilized by the device, some of them are not necessarily that robust. So utilizing something that can send a lot of traffic, such as HPing3, Escapee, or some other item to just replay traffic to a device in an open port, you can get a lot of interesting things happening with the device. Sometimes it will fill up the hard drive or the disk space with your ICMP traffic logs, overwriting things, and then you'll have any number of things happen to where you may crash to a controllable system shell if you're lucky. Other items I've had is just like basically break the device and brick it. So that in and of itself is interesting, because if you have a medical device doing a necessary function, you're able to ping it to death. It may not be a good scenario. Another set of tools that I use a lot when I'm assessing medical devices are things that kind of send keystrokes. Again, I do not want to be sitting behind a keyboard kind of doing this repetitive nature thing, so I'll try to automate as much as I can. In this case, I'll use Bash Bunny OMG cable to go through mass amounts of kiosk escapes or any kind of code that I would like to go in a repetitive nature just by a flick of a switch. You'd be surprised of how many of these devices actually have USB ports when you open them up and kind of expose everything. Something that may look like it's just a closed system actually has a ton of open ports on the inside. In which case, these devices like the Bash Bunny and the OMG cable actually very useful in quickly just going through thousands of lines of keyboard strokes that you'd actually like to recreate on these devices. Also, various PCB boards kind of come into play, and I found them very useful. Similar to the Bash Bunny and OMG cable, these devices are, boards that have a CPU, and in the ones that I use utilize CircuitPython. This makes it easier to actually develop code in my case, and basically emulate, similar to the Bash Bunny and OMG cable, some kind of keystrokes that I'd like to use to try to bypass, say, maybe a keyboard filter or some other protective feature, but again, utilize the keyboard or send data to the device in a controlled manner. And that's where the PCB ports come into play. Some of the favorite ones that I use are the Mini SAM and the Adafruit Bluefruit. Again, those I've all gotten from hacker boxes. I don't know if anybody has hacker boxes here, but I'm a fan of them, and necessarily they have provided a lot of the things that I use in engagements. It's funny, I just go shopping in my closet when I actually want to go kind of get new things. And USB cables and data readers. Again, USB cables, you'd be surprised to find what you can find by just putting a USB cable in your device. When you think about it, a lot of the devices that are medical devices are embedded platforms. These use things like UART and have sometimes exposed, UART ports, or I should say UART serial connections connected through a USB port that's internal to a device. This has happened numerous times where these devices, again, when you utilize such a cable like USB to USB-A, um, plug it in, and then if you connect to the serial port, you are automatically greeted with a shell, which necessarily is not a good thing to have when you're assessing a device. Also, a USB-A to TTL serial cable. Again, utilizing the open ports that are on these systems, you can connect to the UART port using a USB connection, and then thusly connect the serial session to be able to get a shell in some regards off of these embedded devices. Also, again, depending on where you're doing the assessment, you may want to have a card reader with you, some kind of hard drive reader. Personally, I carry around a few. I think I have like 8 that I carry around with me that I've used heavily just due to the different types of drives that I've encountered when assessing devices. So going on to safe coding practices with regards to how things are developed. Again, I think we're in the 21st century, right? So a lot of these devices, again, use code that may be legacy and also may be borrowed and also may be old and recycled code from previous projects. When you look at or are able to get some of these projects into a source code or into a manner that you can actually assess the code behind the project, you'll note that a lot of times you'll see a lot of vulnerable functions. And you're wondering why. But again, this is something that I've noticed that's very prevalent. These are things that are they're taught in a textbook manner, like, don't use stir copy, don't use like memset. But these things are still used over and over again in production projects. And me personally, I'm not a developer. I don't code very well. But again, if I'm able to load an executable or some kind of object into IDA and then read through it and see a lot of these calls, it's not necessarily a good thing. And sometimes they read out like one of these ETF challenges where you're supposed to reverse engineer these things and like, what's the bad function? Finding these, at least in my opinion, kind of indicates that, again, you need to get this off the floor and into the consumer market. Again, in the end, when you try to get a control in place for these devices, utilizing these unsafe functions, sometimes the issues that are developed are so systemic that when you go to apply a control to the issue that you found, the issue is so far embedded in the development lifecycle that there's no fix. So again, why does this happen? One of the why questions. This has happened before just due to the fact that the developers may lack skill. They may not be comfortable in developing this function. This may be the first time they've done this. They may have been borrowed from some other project. And like the slide says, my hats and my heart goes off to these people who are making these things. Again, I did not imagine having to be tasked with making a device that's going to be used in something that's going to be making people better in a medical setting. And again, I know that they're working tirelessly to actually get these things off and shipped. Again, hats off to them for even making the things. But also, as mentioned, sometimes these things are old projects that are reused and redesigned under just a new shield or new functionality. Necessarily, it's old code that's been reused so much that either it's so old that it doesn't exist, or it's so old that nobody develops in it anymore, which I've seen a couple of times when people are, or where I'm in a work function and reviewing code. Kind of a joke on source of view of COBOL. But again, people developing these assets may be utilizing code that has not been used in some time. And then we're asking them to develop a fix for something that they don't even know how to develop, other than the fact that they know how to copy the code and make it work with a little bit of extra functionality. It's kind of a large ask. So going in safe coding, again, you have to think past the actual usage of safe coding to what does safe coding mean? In a traditional sense, safer coding means that somebody like me would not be able to go to a device and overrun a buffer or have an unsafe function that would allow me to get access to the device and, like, get a shell. looking past that, medical devices have the interesting, I guess, feature of affecting us, as it were, in a real setting. So they go past the cyber into the affecting, you as the consumer and the user of the device. So working safely doesn't mean just working in a safe manner. It will physically go from A to B to C. It means working in a safe manner. You have to actually be safe for the person who is using it. Again, some of the things I've observed, pressure tests where, there's no off once the maximum value is reached, just keep kind of constricting, heat tests that have no shut off, for after reaching a heat for a suspended amount of time, flow tests that have no off once the amount of flow has been reached, pills that will keep dispensing out of pill dispenser, but just because it's marked as on. Again, with regards to like imaging devices, you have energy or electrical settings that will go to turn something on to a higher power, but not turn off once it's hit a maximum value. Again, all of these things that are, kind of unsafe functions, I guess, necessarily in the sense that they can potentially harm the environment around them, those all possibly can be reached by something as simple as a kiosk escape on the device in a theoretical setting. And then just looking at it objectively, say you have something that will heat to, say, 200, 300 degrees. Okay, what are you all around? Things in a medical setting, oxygen canisters, alcohols, different sterile things that will, unfortunately have a negative impact if they're introduced to heat. So you have a device that will go to, say, 200, 250, 300 degrees, and it will stay there until you just turn it, like press the off button. You don't press the off button. Instead, you shove in a oxygen tank. And unfortunately, A plus B plus C in this scenario will not equal a happy time. So again, in the end, when you're developing a system, or at least when people are developing systems, what they should be looking to do is to implement security at the design phase. When you're talking about this, like, should we design this thing? Basically, as you develop the asset and develop it with security considered by speaking about these things in an open forum, initially at planning, your risk will go down. Your costs will go down because, again, as you have the controls already baked in during testing and during, I guess, before release to the actual general public, your attack, I guess, platform or your attack footprint should be greatly reduced. So when you actually have to do something, it's going to be minimal. It's just going to be something that you like maybe had not spoken about, or something has come out that you need to, like, say, update a library, versus having to actually go back and redesign the entirety of the device because you've developed yourself into a whole. Going over the need for updates for the things that I guess they're running on, the backbone, the hardware, or even sometimes the libraries. In my opinion, with some of these devices, if it's not broken yet, then I don't think you're looking hard enough, because some of these things are running on very feeble things. And I've asked developers a lot of times, kind of like, why did you do this? Why did you make this like this? Why is this board here? Why does this network card here? Why? And the replies somewhat are similar with these groups. Sorry, knows it just because of this thing. Replies somewhat similar when you get talking to developers across a number of companies and a number of different forums. I've gotten, well, we had these boards laying around, so we just, used them. Or, we built previous models on this board, so we thought it was good enough. The other ones were just, I'm working here for a little bit. This is one project on top of, a fleet of projects where I'm going, here to there, across the country and state and everything. So, I'm always wondering why they were getting into these holes, and then I find out. Now, the internal hardware of a medical device does not need to be very robust. Again, the more simple it is, kind of the better. It's twofold. The more simplistic that they have the device, basically, the less the attack footprint will be. And necessarily, it will just do that one function, which is, to do the life-saving function YE is developed for. But again, the issue that I have is that these devices are becoming more and more prevalent online. So you're taking a device that has been doing simplistic nature things, and providing a service to do that one thing, but then you put it online and expect it to compete with things that do multiple things and have multiple defense mechanisms in line to protect against various network intrusions and traffic sends and whatever else that somebody can physically do to the device. But necessarily you have these feeble things with all of a sudden getting a network card slapped on them, and you expect them to be completely secure. One of the developers that I spoke with at one of these forums, I think, put it brilliantly, and I use this actually quite a bit, is that network is only as good and secure as the hardware that you put in it. I stole that. I'm going to use that from now on, and it's actually kind of true, because if you have a bunch of bad things on the network, these things can obviously take down your network. So it's like, you want to put good things on your network, not, chintzy things with a network card. I wouldn't put a Tamagotchi with a network card on my network. So again, going back to the feeble nature of these devices, again, as mentioned, HPing3, I use that quite a bit when I'm testing devices, because again, if it's carrying out a vital function, I want to make sure that that vital function is going to carry on no matter how much traffic I send it or no matter what's going on in the network, because it has to carry out its function no matter what, because obviously it's critical enough in the medical procedure field, then you would want to make sure that it's resilient. So again, with the amount of ICMP issues, or like say even small traffic issues in the field, the medical device field kind of needs to come to an awakening to where they realize that they actually do need to kind of expand their horizons and start investigating newer technologies that will make their things better in the long run. Some issues that have arisen in the recent medical device scope are interesting, because all traffic flaws have to do with somewhat simplistic things being implemented on the device themselves. As shown, again, Urgent 11, that was a recent advisory from ICSMA. Again, the result of that is denial of service or remote code execution. Ripple 20, again, that has to do with the TREC TCP IP stack. And the result was denial of service or remote code execution. Infusion pumps, denial of service via ICMP, as mentioned previously. Well, first of all, why does an infusion pump have a network jack? But necessarily, again, very simplistic things. Why are these things happening? Why are these things constantly being implemented within these projects? And again, it's the comfort level. Most of these libraries are dated. They're used in industrial IoT items, and they're, air quotes, trusted, but necessarily they're trusted because they're kind of either somewhat it's easier to implement, or again, they've been used in a lot of projects, but nobody's looking at the actual security or the robustness of these implementations, which is kind of the issue. And we keep using these old deprecated libraries, older libraries that obviously the technologies have not necessarily been vetted in a continuous testing cycle. And then we're just going to keep going down this cyclical issue of finding denial of service or ICMP things that lead to remote code execution due to the fact that we're including simple libraries that, again, are trusted, but again, not widely tested with regards to their robustness and their usage in a secure setting, which necessarily medical devices these days, if they're networked or have access, I guess, regards to use somebody walking up to it and accessing it, they have to start being more secure. Which leads us to kind of the summary of, what's going to happen. Right now we're in a space where, people are getting, they're learning more. They're going out there, they're trying new things. used to be there only used to be so many OSCPs. Now there's like a ton of OSCPs, and everybody's like learning and learning. This is great. As more people are learning and exploring, ways to exploit technologies, we're just going to keep getting into the cyclical thing of, people finding a ton of things wrong with medical devices. In the end, I can get any number of awesome owns and just do a lot of cool things with medical devices, but it doesn't do anything. It doesn't make them want to change. And I know that necessarily these businesses make a lot of money making these devices for us to consume, but they are going to have to come to a point where they do take a look objectively at themselves and their business model and want to make the right decision, to start doing research, to start implementing these smart fixes, like planning security in your device versus bolting it on at the end. Change is going to be very difficult for these businesses. They're very large. Some of these people have developers that they only know by a number, or they only hire ad hoc to make these certain functions and then kind of piecemeal these things together. So it's going to be a very interesting future because, again, we're bringing more and more things online for ease of use and monitoring. So as these things start coming online, again, you're going to start seeing more and more of these things being in the news. But hopefully we start seeing more and more businesses start making positive change by coming more and more to, like, say, the biohacking village and producing their stuff to let people test, and then making those fixes based off of what people observe and can physically provide with regards to security findings. And leave you with this. When I started out, I guess, assessing medical devices, I just tore apart this device and I brought up the information, and everybody was kind of peeved. And I was like, why is everybody kind of not accepting, what I'm telling them? And, basically, my director at the time, he's like, sat me down. He's like, you did a great job, but you basically just called their kid ugly, which was, basically just taking their baby that they had made, poured all their, time and effort into, and, just said horrible things about it. So that's not the point here. The point is to start working together in an open way, so everybody that utilizes these devices can actually benefit from knowing that if somebody like you had loved, or somebody was really, really important in our society, that, say, the medical device would be resilient enough in a connected way that they would be safe, secure, that we could make sure that they would be taken care of by the device that has been designed to do that, versus, like, say, somebody intercepting the traffic and modifying it so they're getting a little bit extra with their medications. So in the end, the point's going to be simple. You just need to kind of work together, and if it's broken, kind of work to fixing it. But it's really not difficult in theory, but it's going to take a lot of buy-in from both sides, from the community who's doing the testing, and also the companies that are receiving the testing. They're going to have to objectively look at their projects and want to physically change their practices, their coding ways, their way that they develop things, in order to kind of meet the demand of the interconnected 21st century.